We're going to Washington to carry out the speech that Franklin Delano Roosevelt made 55 years ago, when he said, "This generation of Americans has a rendezvous with destiny." And today we're continuing that rendezvous. We have one last major mission that we're going to try to help accomplish in America, and that is to get a national health plan, period. And we're not going to take any substitutes, no compromises, no business of just opening the door, let's settle for anything. We're going to get us a national health plan that is comparable to what they have in Canada. Amen.
People are up in arms about the current healthcare system. They are tired of the bureaucracy of the insurance companies, the rising cost of healthcare, and the inadequate access to health services. While the president has made healthcare reform a national issue, healthcare activists have been at the forefront, struggling in support of a single-payer plan.
Well, I'm with the New York Mobilization for National Health Insurance, and with healthcare, we gotta have it. And we thought this would be a perfect day to be out on the streets telling people the best gift we can give them on Mother's Day is universal health care. And it's better than Mother's Day cards, and it's better than flowers, to put all that energy, and it's free. You don't even have to pay anything except the cost of a postcard to Congress to tell them we want universal health care. And the only kind of universal health care, of course, is the single-payer system of financing.
We're celebrating Mother's Day one day early and calling on everybody to help us get universal health care for everybody in the United States.
I'm here to support single payer. It's the best way to go. And my group is OWL, the Older Women's League.
Healthcare is a right. 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 Healthcare is a right.
My name is Nadine Alaspina, and this is Shelley Buslowitz. We're disability rights activists. We're with Disabled in Action, Metropolitan New York, with the Disability Independence Day March. The Disability Independence Day March this year is focusing on health care, and we want a single payer. We want the health care reform to take that form. We want a single payer.
What do you want?
Single payer!
When do you want it?
Now!
What do you want?
Single payer!
When do you want it?
Now!
What do you want?
Single payer!
When do you want it?
Now!
I think if anyone really sits down in a room and reads some of the information we could provide, they could not possibly be for anything except single payer. Is that clear?
That's great, thank you.
Single payer means there's a single source of payment, as opposed to 1,500 different insurance companies who write the rules of the game right now and who unfortunately compete all too often to cover healthy people and all too often exclude people because of a prior or current health care condition.
An America in which health care is a right, not a privilege. In which we say to all of our people, your government has the courage, finally, to take on the health care profiteers and make health care affordable for every family.
The president is on the right track and Mrs. Clinton, who's done, I think, great work on this, is on the right track. They have said that they're not going to give up on the principles of universal coverage and decent package of benefits. Our bill is each and every citizen. We don't have tiers of medicine. I mean, we avoid the stratification. And to me, universal coverage doesn't just mean each person's covered, but it means each individual has high-quality care that's provided to them.
Nearly 100 members of Congress have co-sponsored a single-payer national system known as the American Health Security Act, H.R. 1200, S. 491, bills that are currently pending.
The population that we deal with are some of the hardest hit. It's time for people to realize that AIDS is not a moral issue, but it is a health issue. And these people pay the most.
We're looking at individuals that are making a lot of profit, hospitals that are making horrendous profits, and individual doctors that are making horrendous profits, as well as pharmaceutical companies, multinational pharmaceutical companies that are making huge profits, and they don't want to give up those profits because they know that with a national health care plan, it means that there will be a set fee, and the profit margin will be reduced.
The Harlem community and the South Bronx, for instance, are going through major health epidemics of, enormous proportions, comparable to anything existing in the third world right now. But we have so little provision of medical services and so little resources that, we're looking at not only infant mortality rates, but premature morbidity and mortality rates for young women and for young men.
For women particularly, the system is not responding. There's no access for a lot of women for basic family health care that is necessary. The women usually are caregivers. Women take care of everybody in the family, and then they take care of their own health only if it seems to be some kind of emergency.
What we're talking about here is that the Clinton presidency and the shift in the political winds is opening up the space for political issues that have been completely marginalized. We're not even talking about the back burner here. We're talking about people didn't even know about lesbian breast cancer and still don't know. We're talking about sexual orientation is not even in the radar screen of the folks that are writing the questionnaires for the NIH studies on women's health. So we're talking about very basic stuff, and it's similar to other particular needs of the community, like fighting lesbian and gay teen suicide.
People have to understand in terms of the healthcare debate is that it is, first of all, not a healthcare debate. It is an economics debate. It is quite the same thing as tax reform. When we ask the rich to start paying their fair share of taxes, they tell us how terrible it would be for the economy. When we talk about national health care, people tell us all kinds of reasons why we shouldn't do it. But it's basically an economic issue. We are spending $950 billion a year on health care.
I would say one of just the generic population, I think the biggest impediment to people going in and getting health care is economic. If they have to, for example, if they have to put up a couple $100 up front, even if they've got insurance, even if they know they're going to be reimbursed, if they have to have cash out of their pocket at the time of visit, even sometimes $40 could be too much. And it's a matter of paying the rent or having that visit or knowing that they're going to have to put the cash up front, so they've got to save through several paychecks to get that cash. Those several paychecks are the same thing as delaying care.
The issue is, do we develop a rational healthcare system which provides healthcare to every man, woman, and child in the same way? Do we treat the rich and the poor in the same way through a simple system, or do we continue to have the bureaucratic and wasteful system, which, however, rewards the insurance companies and the pharmaceutical companies and certain doctors? That's really what the debate is about. So obviously there are enormous economic forces.
Mrs. Galenta wants to be admitted for treatment of a severe heart condition. Her husband has been in another hospital for 6 months, and illness has eaten up their savings. She's desperate to get into downstate, but she still owes them money from her last stay.
What is your monthly income? $375.30. And you have a balance of $60 from your October admission.
Right.
Would you like to pay that now?
No, if any more payments has to be done or ever anything, I don't know where I'm going to get it. The only thing is, I was one that never wanted to go to welfare. I don't like it. I'm a very timid person. Only in the first years when it first started, the home relief, what could be helped, mostly everybody was on it. And we were only on it a while, and they gave my husband a job. He was a mechanic. That poor man had to get up 4 o'clock in the morning, and they sent him God knows way upstate in the mountains there to go and fix the trucks. That man of mine worked hard. That's why he's so sick today. Trouble with his kidneys. He always used to be on the floor fixing cars. Well, I guess we can stop this now. I can't even talk about it anymore. I get seizure attacks. I've had 3 heart attacks already. That's my life has been in and out of the hospital, in and out, one here, one there, one there. Now I'm really down now.
All right, then if you go into the hospital business office, they'll give you a receipt and would you come back with it, okay? Yes.
How much money do you have left altogether for the rest of the month?
$20.
$20 you got left?
But I went and pay electric bill, and I went and pay the telephone bill. As I say, I take it out of my mouth to keep things clear with me, because I always come here, and I don't want to be marked that I'm a bad payer. But I pay. They can honestly say that I come. Either I pay 5, or I pay 10, or I pay 25. But I manage. I pay my bills. This is the first time I paid a big bill, $60.
With payment made, Mrs. Galenta is finally taken to her room. We used to think that health insurance plans like Blue Cross and Medicaid existed for the benefit of patients. Now we're not so sure. The New York office of Blue Cross pays out $8 million a day to hospitals alone. Blue Cross insists they are vigilant, but we watched in disbelief as their inspectors approved hundreds of claims. No questions asked.
On this 24 days, they're looking for $6,544. And they have drugs of $425. Oxygen, $1,291.
Well, how do you know that they actually took that bottle and gave it to the patient, as they actually administered the drugs to the patient? Do you really have any way of knowing?
Not really, no, but we have to have faith in somebody. And most of the hospitals are first class. I mean, they work with us a great deal, and we have a good relationship with the hospitals.
With little incentive to hold down costs, we are treated in the most expensive way possible. And Blue Cross efficiently funnels our money into the hands of the medical industry.
This is our automatic check signing machine. We sign roughly 180 feet per minute. Our volume is in the neighborhood of 42 to 45,000 checks per day. The checks we're signing now are being mailed to providers, which include doctors, hospitals, and labs.
Health costs are rising 13% every year, $1 million every hour. Even the vice president of Blue Cross admits that payments are out of control.
it's expensive because it says produce something, and as long as you spend the money on us, I'm going to reimburse you.
Do you have any idea how much money society could have saved, just a ballpark figure, if we were not on this cost reimbursement over the last 20 years? How much money would have been saved?
It's billions and billions and billions and billions. You know, it's hard to say because the inflation rate's been running double in the health field compared to the rest of the field for over a decade. How much money is that? You know, 50, 100 billion. So much money, it's almost blue sky. It's just staggering. However, the money's been spent, and it hasn't been stolen. And I don't want to imply that. Sometimes that's implied. It hasn't been frittered away. The hospitals aren't filled with no-shows and thieves. That's not the problem.
Right, but we've built up something that's very, very difficult to change. Even Blue Cross has trouble changing this, right?
Very difficult, very difficult.
Blue Cross, Medicaid, and Medicare all claim to be turning over a new leaf. But now any attempts at reform must confront the power of the medical establishment. From hypodermics to heating pads, from contact lenses to cough drops, American ingenuity has turned healthcare into a $150 billion business.
Now from here, we just ask our patient to put her hands on the side of the table, and we lower the back section. The doctor has not touched the patient. The doctor has not had to lift or bend or stoop or crank, and the patient's never been touched. Automatically put into position. Buttocks at the end of the table. She's locked into place. It's a good business.
Why?
Yeah, it's a very good business. It's a good question. You know, the doctor needs an exam table. It's something that he has to have. And for that reason, and for the reason that we're always going to have sick people, we're always going to have people that need to be examined and that type of thing, it's a very good business in those terms.
Today, people are doing anything and everything to get health care, from staying in unwanted jobs or going jobless and impoverishing themselves to sustain their coverage. Even though health care is a basic need like food and water, in this country it has become a commodity that many of us cannot afford but are dying to get.
People who cannot afford insurance or who cannot get insurance are forced to get their health care from emergency rooms. What's wrong with that is that they're getting very expensive care and they're not getting the care they need. They're not getting care that will help them stay well. They're getting care when it's already too late.
So many people didn't have health care, and now we have all of these different diseases, pandemics of all sorts, leukemia, cancer, HIV and AIDS, and numerous other things, tuberculosis that we're dealing with. And now the healthcare system is overflowing with people.
Pain is in my heart. Tell me why, yeah. Oh, yeah. You know what I mean. Oh, pain you never seen. No. Got to be.
The American economy will never rebound unless we get our health care price tag under control. The simple reason many corporations are practicing in other parts of the world and other borders is because of health care costs.
Every other industrialized country except South Africa has national health care. And so what it does is it puts us at a disadvantage. The corporations in the United States, even the car companies, Chrysler starting as the first one, began to complain that they were at a competitive disadvantage because they were spending more money for health care than they were spending for steel.
Although we spend so much more money than most other industrialized nations for care, we're not in better health. Out of 24 industrialized nations, the U.S. ranks 21st in infant mortality and 17th in life expectancy.
What that means is that in this country of plenty with many healthcare resources, babies are dying unnecessarily. We have enough money in the U.S. healthcare system now to give everyone, including the uninsured and the underinsured, everyone the care that they need when we need it. We have it in the system now.
Currently, we're spending 20% of our healthcare dollar, every healthcare dollar, on insurance companies, the billing and administrative costs, nothing having to do with care.
If you go with a broken leg to a hospital and you need to have an x-ray and somebody set your broken leg, you have unleashed a mound of paperwork that the average person does not know about.
Marv, I got a feeling that we're going to make a killing today.
Oh, yeah? Where's your machine gun?
The main thing about money, Bud, it makes you do things you don't want to do.
Paid in full.
Miss Smith, I'm looking at your form now, and I can see that they were filled out incorrectly. Ma'am, we are unable to help you. I'm sorry. You failed to fill out Form H212 to authorize tests, and you did not correctly complete Form B35.
Paid in full. Paid in full.
Insurance is a business. They want the people they want you to pay your premium, but just don't get sick. Meaning keep giving them money, but they don't want to give any of it back to you.
So they skim off those people in our society that are the healthiest and cost them the least. Then they deny those people that need services the most, that have expensive conditions like cancer, HIV, and diabetes.
And who pays for this? We pay for it. We pay for it out of our pockets, and we pay for it out of our hides. We pay for it out of our taxes. Because who the insurance companies don't take care of, who they deny, ultimately are dependent on the government, on the state, and we wind up paying for that out of our taxes. Americans pay for care in a variety of ways, through private insurance premiums, co-payments and deductibles, through out-of-pocket costs for services like long-term care, which insurance policies do not cover, through workers' compensation and auto insurance, through wages lost in exchange for on-the-job coverage, and through taxes used to pay for Medicare, Medicaid, and other health care programs. These payments hold together a fraying patchwork of public and private insurance companies that leave millions of people uninsured and even millions more dangerously underinsured.
The multi-payer system is not a system at all. It's a disorganized free market free-for-all where consumers are paying multiple times for services they may not even be receiving.
The healthcare system, well, it sucks.
They got a walk-in clinic in this hospital that you walk in at 9 in the morning and you'll be out of here by maybe 9 o'clock in the night.
Go through so much red tape and all. Stand in line. Some people they can't take it.
Yeah, but they only want their money, you know? If you don't get the money, you don't get treated.
After a while, the poor people won't be able to afford medical care, no kind of care at all.
Many of our politicians are leaning towards an untried healthcare reform proposal known as managed competition. This chart, prepared by the Office of Management and Budget, explains how managed competition would work.
Managed competition is a theory that has never been practiced anywhere on the face of the earth. It's something that a group of rich, white CEOs, major executives of your insurance companies have come together and decided that this is a way that they can compromise and still not lose their millions of dollars.
Managed competition would not only leave the insurance companies and their current system of administrative waste intact, It would actually add another layer of bureaucracy to this system, increasing costs. Under managed competition, purchasing co-ops would be created to buy your health care from insurance companies. These new purchasing co-ops, whether they be your employer or the federal government, would save money for the country by offering bare-bones minimum benefits plans. Financial deterrents, such as very high premiums and deductibles, would squeeze the consumer to do without and block all but the wealthiest from receiving comprehensive coverage.
Instead of saving money by trimming bureaucracies, the various proposals plan on saving money by limiting care, treatment, and freedoms like doctor choice. They would push all but the very wealthy into tightly controlled managed plans. Bureaucrats would decide what kind of care you could get, how much, from whom, and when.
Managed competition will still give you this rationing of health care. Some people will get better, some people will get worse, and that will depend on A, whatever race you are, B, where you live, C, your income, your age, whether or not you need long-term care, whether or not you're HIV positive. All of these factors will still exist.
Our legislators are elected officials, and what we have to begin to do is flood their offices with phone calls, with visits, with letters, with petitions. We have to get out in great numbers and let them know that we don't want any more insurance companies, that we want single payer, that we care about the American people, and that legislature isn't just about paperwork.
Single payer is a universal, comprehensive national health plan currently being used in Canada and in various forms around the world. Single payer eliminates the insurance company middleman. The money we're already wasting on insurance company bureaucracy and profits is redirected into a national healthcare fund that would cover everyone under the same comprehensive, high-quality plan. The fund, administered by the government like Social Security, is financed through a progressive tax. A progressive tax means people would pay according to their means, not their health status. Under single payer, not only would nearly every American, 80% of us, be paying less for care, we would be covered for more.
Single payer is not spending more money. Single payer is just redirecting funds that are already spent on bureaucracy, paperwork, and administrative costs.
Even the General Accounting Office has said that if we had a single-payer type of system like Canada's in this country, we would save about 10% on our health care bill. That's enough money to put back into the system to provide health care for all of the uninsured and underinsured people in this country.
Single payer would eliminate all financial barriers to care. There are no bills, co-payments, deductibles under single payer.
And we all have this one card, whether you're a newborn, whether you're 60, 70, 80 years old, whether you're Donald Trump, or whether you're the homeless man on the street, you just have this one card with your name and your Social Security number. It will reinforce the idea that health care is a right and not a privilege.
Under single payer, the government will have enough leverage because they are the only people who are going to pay the pharmaceuticals and the health industries. They will have enough power to negotiate costs and will be able to contain costs because the entire industry will not turn its back on the American population.
Our parents and grandparents struggled. They got Social Security, but they didn't get health care, even though they attempted to. Then in the 60s, they tried again. They got Medicare and Medicaid, but still millions and millions of people were left out. And so now it's our turn.
It's Healthcare in Jeopardy! And now, here's your host, Ray
Sunshine.
Hi, everybody, and welcome to the show. So first, let's meet our three contestants. He's the CEO of a national insurance conglomerate who enjoys hunting and trapping. Here's Fred Majorbutts. He's a board member of a major metropolitan newspaper who says he just loves the smell of newsprint. Here's Bob Metropage. He's a freshman congressman who says he gets a special kick back out of serving the public. Here's Jim Lostman. And I'm your host, Ray Sunshine. Gentlemen, welcome to another fun-packed edition of every special interest favorite game show. As you know, the object of our game is for our contestants to correctly guess the questions to answers provided about the healthcare issue in exchange for absolutely ridiculous amounts of money. And as opposed to the real game show Jeopardy, we don't even care if it's in the form of a question or not. So, let's look at today's category, shall we? Public perception, friends and benefactors, fun facts, healthcare memory lane, and money, money, money.
I'll take fun facts for $20 million.
Under managed competition, choice of physician would be left to...
Your mother.
Please.
The government, I think.
Sorry, Jim.
I believe that choice would be left up to us at the insurance companies, Jim.
Afraid you're right, Fred. The public's right to know all the facts about potential healthcare programs is secondary only to this.
What is our need to sell papers?
Wrong. Jim?
What is national security?
Sorry. Fred, you want to take a whack at this?
What is communism?
No, Fred. It isn't communism. It never is. The public's right to know isn't secondary to anything. Now, whose turn is it? Doctors who feel universal health care is a national necessity.
Who are communists?
No. Shut up already, Fred. You know, I'll bet Pat Sajak doesn't have to put up with this kind of... Bob?
Who is nobody I know of?
No. Jim?
Who is Physicians for a National Health Program?
Hey, hooray again, Jim. But, Fred, since you ticked me off, we're going to go straight to Final Healthcare Jeopardy. Okay, contestants, make your wagers. The Final Healthcare Jeopardy category is public accountability. The answer is group most responsible for the current healthcare mess. Hey, Jackie J, tell everyone how they can become a part of all this.
Send your letters to Washington, D.C., care of your congressional representatives. Tell them your health care's in jeopardy. And while you're at it, drop a note to Bill and Hillary, too. Ray?
Okay. Group most responsible for the current healthcare mess. Bob?
Who are the media? Outside of the New York Times, of course.
Wrong, Bob. How about you, Fred?
Who are consumers who need too damn much health care?
Also wrong, Fred.
Wait, I think I'm catching on, Ray.
What's your answer, Jim?
Well, that's really so obvious. Who are the insurance companies?
Yes! Absolutely right!
We give mainstream media coverage of the healthcare reform issue thumbs down. All around.
I don't have the skill to save the world. National health is not my concern. But I'm legitimate, ain't no cheat. Call me your doctor. Call me your doctor.
For years, I've been interested in healthcare, and I've noticed that the number one prospect, in my estimation, for a good reform of the system never got much press, not on television and not in most of the newspapers and magazines, despite the fact that public opinion polls show that most people are in favor of it. I'm talking about a single, so it's called the single payer plan. It's a terrible name. It should be called the freedom of choice plan. It'd be a system as in Canada, where the government is the only insurance company.
we stand four square for a Canadian type, single provider, single payer plan. It would be the best thing in the view of most experts who haven't personal access to grind or special interest to serve for the majority of the people of the United States.
The New York Times has been one of the leaders in narrowing the debate on healthcare reform. In an editorial in October of 1992, the New York Times proclaimed that, quote, "The debate over healthcare reform is over. Managed competition has won." And the New York Times declared that this outcome was delicious and wondrous. Managed competition, which is not exactly a household word, appeared in 62 New York Times news stories in the 6 months after the 1992 election, whereas single payer appeared in only 5 news stories, never in more than a single sentence mention.
We tried so hard to get the New York Times to cover single payer seriously. I mean, they were heavily into the healthcare issue, even had special issues, special supplements and everything. Well, they wouldn't even cover an op-ed piece by Congressman McDermott, who wrote the bill. The bill is supported by virtually every member of Congress in New York City, 12 of the 14. And this, you know, it's a major story, I think, and yet the New York Times wouldn't even talk about it at all.
You know, the motto of the New York Times is all the news that's fit to print. My book is called Unfit to Print. The subtitle is What the New York Times Doesn't Want You to Know About Healthcare Reform.
The New York Times has a real conflict of interest on this question in terms of healthcare reform, because 4 of the members of its board of directors are also on the boards of health insurance companies. You know, its board is full of people who are going to directly benefit from managed competition.
White health care is a right, not just for the rich and white.
We put together this leaflet, and we did a demonstration in front of the New York Times, raising hell about the fact that they would not cover single payer at all.
My own opinion is that profit-making should have absolutely no part in providing or trying to maintain the health of the people.
Someday, when I'm awfully low, when the world is cold, I will feel a glow just thinking of you and the way you look tonight. There is nothing for me but to love you just the way you look tonight.
Television and radio ads began trying to shape public opinion about the Clinton health care plan even before the president formally announced it last month. The battle has intensified since then as interest groups on all sides of the issue have taken to the airwaves.
Well, interest groups on all sides, it's funny when they say all sides, what they usually mean is both sides, as they define both sides. And the debate that you generally see is actually 2 sides of the health insurance industry.
We have a sampler starting with 2 ads that preceded the president's speech to Congress.
This was covered under our old plan.
Oh, yeah, that was a good one, wasn't it?
Things are changing, and not all for the better. The government may force us to pick from a few health care plans designed by government bureaucrats.
Having choices we don't like is no choice at all.
If they choose,
we lose.
For reforms that protect what we have, call toll-free. Know the facts. If we let the government choose, we lose. Call today.
And that's the HIA. They're the small insurers, and they don't want any kind of change. Because if you move towards managed competition, they get squeezed out by the big guys. And if you move towards single payer, they'll also get squeezed out. So they basically don't want any change, or at most cosmetic change.
Have you seen this ad attacking the president's health care plan? You have to read the fine print to see who paid for it. The insurance industry. They've launched an ad blitz to stop the president's health care plan before he even announces it. After years of denying people coverage and jacking up prices, the insurance industry is scared that change is really coming. Tune in on September 22nd and listen to the president's plan yourself. The insurance companies may not like it, but the president didn't design it for them. He designed it for you.
So the Democratic Party is positioning themselves as a foe of the insurance companies. They're not. They're a foe of the small ones, and that's totally being obscured.
First Lady Hillary Rodham Clinton fanned the flames of that dispute yesterday when she angrily accused the industry of lying about the details of the president's plan simply to protect its profits.
What you don't get told in that ad is that it is paid for by insurance companies who think their way is the better way. They like what is happening today. It is time for you and for every American to stand up and say to the insurance industry, enough is enough. We want our health care system back. We want our health care system back.
This segment was played over and over again on all the nightly news broadcasts under the framework of Hillary Clinton's really socking it to the health insurance companies. She's standing up to big business. It's extremely disingenuous coming from her, and it's, you know, it's outright lie on the part of the mainstream media to portray this as an attack on the health insurance companies. It isn't. It's an attack on a narrow part of them. And her husband, Bill Clinton, recently stated that to a bunch of big insurance companies. Our plan is actually very favorable to you guys.
Yes, you're lovely, with your eyes so warm, and your cheeks so soft. There is nothing for me but to love you, just the way you look tonight.
The managed competition system was something that was dreamed up by a group called the Jackson Hole Group, which was a group of people who met every year in Jackson Hole, Wyoming, to talk about healthcare reform. And there's actually a picture in the New York Times of the Jackson Hole Group, and referred to it as Hillary Clinton's potent brain trust on health reform. This is a coalition of corporate American healthcare. You don't see any representatives of grassroots groups here. These are, in many cases, representatives of Fortune 500 companies who are figuring out how you can do healthcare reform that isn't going to undercut their interests.
Think of the oil and gas business, which evolved out of vicious competition through a system of cartels into its final encrusted, socially destructive system of transnational corporations, steadfast in their refusal to change, an expensive, inefficient, and environmentally destructive energy market. Do we really want a Seven Sisters of health care?
Something's really wrong with our national discussion when we can't get beyond a debate within an industry. You know, it excludes, you know, the entire population, for one. It's a debate between, you know, the guys who run, you know, a health insurance company that only has $100 million worth of assets against the guys who have $100 billion worth of assets, and that's the argument.
The single-payer people, even when they do appear, in very rare instances, they're treated as sort of marginal outsiders who have a sort of wacky idea that we'll give them a few moments to explain it.
There was a particularly revealing episode on McNeil Era last May, where McNeil was interviewing Steffi Woolhandler, who was one of the few people who are for a single-payer plan to get on. She's from the Harvard Medical School.
Dr. Woolhandler, leave the last word with you on this, since you're in a minority. If this is the only political...
Robert, I'm not in a minority. Polls are showing 2/3 of the American people support government-funded national health insurance.
In this discussion, but I was going to go to that. If this is the program that has a political consensus, and the other one that you advocate is considered impossible politically at the moment, what are you then against the one that is viable and would produce a large element of reform?
We don't think managed competition will actually provide Americans with the care they need. We don't think it'll control costs, and we don't think it's going to give Americans the choice of doctors.
So you
So
would
it
say,
doesn't really meet the needs of the American people or
So-
of my patients, so I'm opposed to it.
so you would say, don't do anything at this time if you have to do managed competition? Is that what you're saying?
I would say continue to mobilize the American people, educate them to get what they need, which is a single-payer program that covers everybody and allows you to choose whatever doctor or hospital you want.
Okay.
That's what our organization, which has 5,500 physician members, is advocating.
Okay, thank you, Dr. Woldhandler, Congressman Cooper, Governor Lowry, and Dr. Chasin. Thank you.
It's not politically viable because it steps on the toes that he deems are holy. And you can't step on those toes. You can't step on the toes of the health insurance companies because, well, they sponsor a lot of things and they're just a generally very powerful political force. They sponsor McNeil Lehrer.
And by New York Life, yet another example of New York Life's wise investment philosophy.
Single-payer advocates have tried to buy their way into the debate. The group Neighbor to Neighbor has made an ad that deals with the single-payer system and can contrast it with managed competition. And they have been unable to get most TV stations that they've approached to even air the ad.
Listen, why don't we get rid of the health insurance companies? Let's go to the blackboard. Here's what we spend on health care. It's a lot. But if we get rid of health insurance companies, we can have complete coverage for everyone for the same money. But any plan that keeps these guys in business will cost billions more in taxes, taxes, taxes. To me, it's a no-brainer.
It's time for them to go. Call Congress today.
They come up with a variety of excuses about how it is not well documented enough, as if the beer ads that you see every day are full of documentation. But there was one station who was honest enough to tell the people from Neighbor to Neighbor that they get a lot of money from health insurers as advertisers, and they don't want to take a hit from them.
Unfortunately, President Clinton, during this election campaign, spoke like he was a man of the people, and he made great to-do in his speeches about bringing about change for people, putting America back to work and correcting inequities. Unfortunately, when he got to Washington, he embraced most of the program and policies of the Republicans and of big business.
When Clinton, during his State of the Union address, got up and said, I want a plan that will guarantee everybody private health insurance, or I will take this pen and veto it, everybody reported that later as he was saying that he wanted universal coverage, which isn't what he said. He said, I want private health insurance for every American.
Nobody in Washington is talking about health care anymore. They're all talking about insurance, and the public's about to get ripped off. So if we don't do something about it and to spread the word, you know, it's a very complicated subject. Most everybody's kind of confused about it.
They think that the Clinton plan has some similarity to single payer, and it really doesn't, other than the name. He took the name. Ours is the American Health Security Act, and he named his the Health Security Act of 1993. And then he used the health security card, which was a part of the campaign that we've been using.
There's a lot of assumptions in the mainstream coverage of healthcare reform that are just wrong.
Call me a doctor if you want. I'll get the cure out to be administered before sleep. Call out the thing you really want, and I'll be there. I'll make a house call. I'll find the problem's root, no matter how deep. Call me your
Well, people have worked real hard to try to make you think that their list of principles is really national health care, just what we need. But what you have to look for, I mean, there are 2 or 3 real keys. Choice of providers, choice of doctors, and progressive financing. What we want is financing that has the people who make the most paying the most, and the people who are making the least pay the least, and people who can't afford to pay anything paying nothing. The third thing I look for is, does it get the insurance companies out of the middle of it?
To the extent that people have been able to get information through the media, it's mostly been through, what's called alternative media or independent media, non-corporate owned media. The nation has consistently done good reporting on this, the Progressive, in these times, and so on.
Call me your doctor if you wanna be there with bedside manner.
93 members of Congress, of the House, have signed on to the single-payer bill, and 5 members of the Senate. So we're far short of the number of votes to win. We think that possibly up to maybe 185 members of Congress would vote for single-payer if we get it to the floor, and we hope we will be able to get it to the floor.
It's such a serious situation. It really warrants for all people to contact their congressmen and senators and demand it, irately if necessary, because the Congress is trying to pull a fraud on the people.
Because they know that once the American people get a chance to look at it and see how superior it is, it's really going to be hard for them to vote against it.
An honest examination of the actual facts cannot come to any other conclusion.
League of Women Voters has been taking ads on television and full-page ads in the New York Times, saying that if you want to really consider the facts, as Johns Hopkins and Harvard University, their research shows, you call 1-800, feel like Jerry Brown, 1-800-FACTS-94, and within 2 weeks you will have a chart which compares on 25 criteria the health plans that are in Congress. And just sitting down and studying that will prove that this is right.
Single-payer system of national health insurance in the United States. We're also here to grab media attention because the broad popular support for the only plan that will give us universal, comprehensive coverage, choice of doctors, progressive financing, and public accountability are these 2 bills, and we want it in the media.